Before surgery, your medical team needs to know how well your lungs work. They use pulmonary function tests, or PFTs, to measure your lung capacity and how efficiently you move air. This is crucial for the anesthesiologist, who manages your breathing while you're asleep. Anesthesia can affect breathing, especially if you already have lung issues like asthma or COPD. PFTs provide a baseline, helping doctors anticipate problems and tailor your anesthesia plan. The test is simple. You breathe into a mouthpiece following a technician's instructions. The results show if your lungs are healthy enough for surgery or if extra precautions are needed. PFTs are especially important for people with chronic cough, shortness of breath, or those having major chest or abdominal surgery. Ultimately, these tests help ensure your safety before, during, and after your operation. PFT results use a few key numbers. Forced vital capacity, or FVC, measures the total air you can exhale after a deep breath, like the size of your lungs. Forced expiratory volume in 1 second, or FEV1, shows how much air you can blow out in the first second, revealing how open your airways are. The FEV1/FVC ratio compares these two numbers. A healthy ratio is usually 70% or higher. A low ratio points to obstructed airways, while a normal or high ratio with low volumes suggests restriction. Doctors also look at the flow volume loop, a graph that can reveal specific problems. Peak expiratory flow rate, PFR, measures your fastest exhale, and FEF 25 to 75% looks at airflow in the middle of your breath. Maximal voluntary ventilation, MVV, tests your breathing muscle strength. Together, these numbers paint a detailed picture of your lung health. Understanding them helps your team plan the safest approach to your surgery. Doctors use PFT patterns to diagnose lung problems. If your FEV1/FVC ratio is below 70%, it signals obstructive lung disease, trouble getting air out as seen in asthma or COPD. In obstruction, FEV1 drops more than FVC and the ratio falls. A bronchodilator challenge, repeating the test after inhaling medication, can show if the problem is reversible, like in asthma. Restrictive lung disease is different. Both FEV1 and FVC are low, but the ratio stays normal or high. This means your lungs can't fully expand, often due to media group, CT scan, showing lung scarring, obese patient with doctor discussing breathing issues, patient in wheelchair with respiratory therapist for muscle weakness, distribute equally, scarring, obesity, or muscle weakness. Recognizing these patterns is vital for anesthesia planning. Obstructive and restrictive diseases require different ventilation strategies. The right diagnosis helps prevent complications during and after surgery. PFTs give anesthesiologists the clues they need to keep you safe. That's why these tests are a standard part of pre-surgical care. With PFT results, anesthesiologists customize your care. For obstructive diseases like COPD, they use medications and ventilator settings that keep airways open and allow longer exhalation. For restrictive diseases, they focus on smaller, more frequent breaths and higher oxygen to protect stiff lungs. If your lung function is severely reduced, surgery may be postponed to improve your condition first. This could mean medications, rehab, or other therapies. During and after surgery, the team uses special precautions like suctioning airways and managing pain to prevent complications. Early movement and good pain control help you breathe deeply and recover faster. PFTs guide every step from anesthesia choices to post-op care. The goal, a safer surgery and smoother recovery for patients with lung challenges. Pulmonary function tests are more than numbers. They're a roadmap for safe surgery. They let anesthesiologists tailor every detail, from drug choices to ventilator settings. By understanding your unique lung function, the team can prevent problems before they start. PFTs turn surgery into a partnership, giving everyone a shared plan for your safety. For those with lung disease, this preparation can mean the difference between a smooth recovery and serious complications. A simple breathing test done before surgery can have a profound impact on your outcome. It's about planning, precision, and putting your safety first. That's why PFTs are a cornerstone of modern surgical care.